Well, hello. We are live. Let's hope we have some sounds. Let's do the intro. Ladies and gentlemen, welcome to my channel, Nursing Education Tutor. My name is Cheryl Spencer. Haven't been on for a minute live, but decided I must come on. I really have. So the typical live stuff, we wait for a few people to come on, and I am totally grateful that you still want to come and hear from your favorite nursing education tutor. So type something in the comments so I know you're here. Miles, hello, Miles Morales. How's it going? How's it going with you? So put something in the chat. Hey, how are you, Andrea? I had to come on. I just really had to come on. So I really had to talk. I could not. I could not come on and talk about this first nurse, frontline worker, who I don't know how the selection process went, but will go down in history as the first known person in the United States to receive the COVID vaccine. So we really have to talk about that. And besides the fact of her melanin and the fact that she's a nurse, we have a lot in common. She's a sister. So I'd like to, hear you guys talk about that in the chat. So for those of you coming on, oh, the balloons are here. Someone, not me, but someone celebrated an amazing birthday. And there's just so many balloons around the house. I have them in every room. So we're going to share the balloons for a minute. She is truly a hero, Miles. A hero just based on her profession. And you know the funny thing with the whole term hero, I'm always a bit cautious to use it. I always said, I don't want them to call me a hero or an angel, because I feel sometimes that takes away from your education and your training. Like, I didn't wake up and click my heels like Dorothy and I'm in Oz. It took some training, of course. To be a good nurse requires some good moral character. Your moral compass must be, we're not all perfect, and there's some in the profession that need to go, but a good, passionate, caring, compassionate nurse who advocates, it takes a good moral human character. And then there's training, either training with a physician, training in a hospital, or in the professionals. Nursing is now in the academic setting. So, but yes, she is a hero, and I am certainly happy. I hope there's a lot of positive that comes from this for her. All the praise, some dollars, because you can't take praise to the bank, um, and some real profession. But I hope she gets a good manager. She will need that, because with publicity comes all the other basura that comes with that. So I'm hoping. So I'm really really happy. I'm really happy for her. Aren't you curious how they decide who'd be the first? Um, I'm really curious about that. So I'll repeat this as I go, but disclaimer. Um, she works for Long Island Jewish Medical Center. My first job was at Long Island Jewish Medical Center. I am extremely proud of Long Island Jewish Medical Center. In 1990, I was 2. My first job was at the old Long Island Jewish Medical Center. Yes. So I know the whole story between the merge. I was in administration, but it was Lij in New Hyde Park and Manhasset in Manhasset, and there were 2. They're like fighting cousins. They didn't get along, and there was this proposal. So I knew it before then. So I do know the system. So I'm really excited when I saw Long Island Jewish Medical Center and Time Magazine. I mean, I'm just not even going to get political, because the person of the year of 2020 is the healthcare worker. Perhaps Time Magazine did not get that memo. I'm just saying. That's all I'm going to say about that. I never care to make my channel an editorial, but like what rock was Time Magazine under. So they've named the healthcare worker and as a guardian, which I agree with that. So yes, my first job was at Long Island Jewish Medical Center, 5 North. Here's something else, Andrea. This amazing nurse, her name is Sandra Lindsay. She's a CUNY graduate. Shout out to CUNY. Guess who went to CUNY? Guess who is a full professora in CUNY? Plus, she's a sister, and I'm happy. From the report, she went to Lehman College. I'm excited about that for her. Now, I would be remiss if I didn't talk about. Um, I I would be really remiss. Now, let's be honest. And I've worked for Lij. I'm going to say maybe about, I guess, sometime before June, July. There was this video that put out, and I called a friend of mine who worked for the system, and I said, "You've got to be kidding me!" It, I think, probably about 3 minutes and 30 seconds into that video, where I saw a Black person, and I'm thinking, "You've got to be kidding me!" I know they're there. I know some are in leadership positions. So here we are, front and center, Black nurse, and the practitioner giving the injection also Black. I mean, I hope it was truly done in a very open way, but we would talk about the whole Tuskegee experiment and African Americans' mistrust of healthcare in lab coats. That's all I want to say about that. As an educator, you should really be aware of the history of abuse in research, and not just the people of color, but just the whole history of abuse in research. So, of course, Michael Dowling was there, and Cuomo was on the other split screen. There's politics involved, but I don't want to give any of them any credit. I want to thank Miss Sandra Lindsay, a registered nurse, member of our profession, nurse of the year. Part of the person of the year, for being that. Of course, we'll all be watching her. And just today, a friend of mine, I'm going to give him a shout out on this video as well, because he's part of the health team. So I'd like to give a shout out to my friend, Dr. Sean Caniff, who's a neurologist, and he got his frontline worker. He's been working. He got his COVID vaccine today, and just for the heck of it, if you want to Google Sean Caniff, Dr. Sean Caniff, my pal, was one of the first members of the TV show Survivor. True story. I know everybody. But enough about that. So I just want to do, congratulations, Sean. Little Irish boy from New York went to Miami and married a nice Cuban girl, have 3 kids, doing an amazing job. Again, so look at the first one with, who's that? Richard Hatch, Sean, Jervis. I remember their names like Susan. I remember their names like it was yesterday. But long story about that. But again, so members of the profession are getting the vaccine. So shout out to Nurse Sandra Lindsay. From what I spoke to somebody else, I think she's a manager. I don't want to minimize her title, but she's in a leadership position at Lij, and I'm thankful for that. And I think they need to promote that. Lij it looks more diverse. It is more diverse than that video that they put out. I almost sent. So, Mr. Dowling, if you get this, let your marketing stuff be reflective of what your staff is, because it'll allow a little girl in Hollis, Jamaica, Glen Oaks, Manhasset, Flora Park, Lake Sussex, Roslyn, Kings Park, Sands Point, to come down. It's good. All isn't about color, but color is a part of the dynamics of this beautiful mosaic that we call the world and the healthcare profession. So enough about that. Let's talk about you, Andrea. I'll pick on you. What's your take on the vaccine? When are you getting it? Are you getting it? Waiting. Let me hear. And Miles, you can answer the same question while here. And thank you so much for coming to my channel. I really appreciate it. I'm trying to be, a little consistent. For a few of that know or don't know, it's been quite a rough year. Not, I don't put too much personal out there, but life is human. On July 12th, my mother died suddenly while my mother had health issues. This was sudden. So I'm a bit under the, what was the question? The question, Miles, is, are you standing on line to get the COVID vaccine? Just no, not to put you on the spot. What's your feeling? Are you ready to get it? Yeah, July 12th, July 12th, Sunday, my mother, about 9:30, my mother died. Like I said, it was sudden, not COVID, but probably a COVID collateral because she's retired, and had it not been for COVID, should have been back in the U.S. for her physical. But so I've been a bit under the weather. I mean, emotionally, probably for the first time in my life, I truly can understand when someone say, "You can die from a broken heart." I've had those moments. I don't profess that our relationship was perfect, but there's some feelings of emptiness when the woman, right, the person who was your connection to this earth is no longer physically here, and then you have to deal with all the other stuff. And as much as most people, I think they're well-meaning. They're well-meaning. It's the humans are quite selfish. That's been my hardest thing to really accept the past couple of months, to really accept just how selfish human beings can. Even in your grief, they're really not asking for you. They're just taking an opportunity to talk about themselves. And I've just learned to just accept that and back off and just be. So, Miles, your grandfather, oh yes, Miles, I'm really sorry about that. It is, life does have its shortcomings, but I'm sure. And to be honest, and that's part of the reason why I said I need to get back, because of part of what I do. There is no way that I would pass and not talk about this. Talk about her. I'd be talking about Miss Lindsay, rather, whether I had in a relationship with LIJ to begin with. But how could I not? I mean, how could I not? You have a nurse leader, check. Melanin, check. Frontline worker, check. She went to CUNY. I mean, New York. I mean, you'd be like, "Hey, professor, what's up? Why are you not talking about this, sister?" I mean, oh, and by the way, Dr. Kenneth Sean, he worked for LIJ, so it's a short circle. Time heals. Hey. Yeah. It's stages of grief. But I don't stay down for too long. And of course, I'll do something with my mother's memory at some point. My mother, believe it or not, one of her favorite stuff was to cook for people. I don't cook too well. I mean, I can. She really got joy out of cooking for people. She taught me to give. She taught my sisters and my brother, to be kind. And I'll take that from her as long as I live. And I hope I have a lot more years, So you love cooking? Oh, Miles, hook your girl up. But yeah, so here we are, 2020. My goodness, I want to bury it. I want to have a shiva. There goes my Long Island Jewish stuff. To answer my question, yes, Miles, answer my question. Your mom, oh, Miles, don't start that type of fight. Don't start that fight. Don't start that fight. Don't start that. My mom makes the best meals, whatever. I talk about that in I mean, 2020, I'm telling you, we need to have a wake for it, sprinkle some liquor in that sucker, put a steak in it, and send it out. But I think in all things, whew, somewhere in it, somewhere, I'm in the UK, we'll definitely take the vaccine. It's coming. It's coming, Miles. It's coming. It's there. They're already starting. I'm gonna ask you. Yeah, Miles, it's there. Oh yeah, don't even start with my mother's the best cook. Let me tell you something. This is why your mother's cooking is the best, because she gave it to you with all that love. It's the emotion that's attached to it. But my mother was the best cook. So there we go. We're fighting. And Miles, I do have family in the UK. Um, I was born in Jamaica, West Indies, UK. Basically, I have family in Sheffield. I have family in London, and wherever the big Jamaican. Oh, Bristol. I have family in Bristol, Sheffield, London. Both are moms. Yes, Jamaica. Did I stutter on West Indies? I sure did. The Commonwealth, the whole thought of the Queen, plundering. Trini, flag in the end. I know Trini. Come on, Trini. Listen, we're all cousins. We need to stop fighting each other. We're all. I need to. You need to go to Jamaica. You need to go to Jamaica. Well, I would wait a little all the COVID stuff, but it's beautiful. It has its problems like everything else. It's yeah, throwing flag in the air like we're up in Eastern Parkway. Speaking of Trinidad, there's a childhood friend of mine, Miles. He's part owner of a company called Trin Jam Foods, Trinidad Jamaican Foods, and there's a Trinity to the bone. Yeah, man. I love how we just turned this into a little flag in the air carnival. Can't take West Indian people nowhere. Can't take the West Indian people nowhere. Where my no Haitian peeps? Up, I say. That's the culture of my people. I love it. I love it. I love it. Yeah. So back to that there vaccine. Here's the thing. Trinidad Carnival, the best. I believe. Oh yeah. Trinidadians know how to do the carnival. Yes, they do. They do. They do. They do. Um, back to the vaccine, and here's my take on it. Or some point I'll get the COVID vaccine, the same way at some point I've gotten the flu vaccine. If I worked in a bubble and I was not exposed to a whole bunch of students, whole bunch of sick people, I would take the flu vaccine. I take that flu vaccine and my arm, the next day, it's just painful, few parts numb, I have a little bit of sniffle. I'm an educated health care individual. I know that I did not get the flu, but yes, I am one of those people that get that full 1 day symptoms from it. It's brutal. But I take it because one, I have to, and two, because I'm exposed to the webcam acts up. I'm exposed to so many people. Plus, I'm popular. I'm around a lot of people. I'm around a lot of people, and I don't want to. I don't want to. Yes, I don't want to risk me getting it, bring it to my family, or vice versa. Andrea, indeed, I know one person who did get Bell's palsy from it. So it's not a myth. I know one person. Now, I'm sure the statistics are going to tell you that that one person is so rare. Imagine that one person. And that's all I'll say, because I'll probably say something else and I don't want to. The person wasn't a patient of mine. So, but it's somebody's personal information. Young person who can no longer work in their profession. Got it. Somebody that I can, no, it's not something that I read. So it does happen, but it's just, the same thing as everything that's on informed consent. When a surgeon comes up to, here I am teaching again, when a surgeon or one of his or her associates, or it could be a nurse doing some type of whatever the invasive procedure is that needs informed consent, whenever that individual and his or her associate and a nurse to witness the signature goes, that informed consent has a whole bunch of stuff that says, in addition, there's a possibility down there of maybe death. So I'm sure, even though getting the flu vaccine doesn't involve an informed consent, it's a general consent, there is a rare person who will get Bell's palsy, and that's unfortunate. So when people say they don't want to get it, I don't judge. You try to understand and try to educate. Are there years that I haven't gotten the flu vaccine? You betcha. Like I said, if I was not in this profession, that I'm exposed to so many people, and my life does not involve me, pretending I'm the mayor of the town and I know everybody being so open, I probably wouldn't get the flu vaccine. So here we're at the COVID vaccine. What a horrible year that this has been. And, there's so much trust. There's so much trust that is implied in getting this vaccine. But anyway, that's all I have to say about that. Do you think the program is going to give? Oh, of course. Come on, Andrew, listen to me. Let me explain, something about the term mandatory and I guess democracy. And, politics is just politics. And I'm sure somebody else has said this before. It's easy for all of us to say, oh, they're not going to make the COVID vaccine mandatory. Okay. Is the flu vaccine mandatory? It isn't. It just says if you don't get it, you can't come. If you don't get the COVID vaccine, you can't play sports. If you don't get the COVID vaccine, you can't work. That's how democracy makes things mandatory. It's going to be mandatory, Andrea. I mean, it's going to be mandatory. I just call things the way that I see them. Um, even before COVID, and I take students to certain hospitals. There's certain hospitals where if the healthcare worker either chose not to get the flu vaccine or they have a known allergy, they did what I call the public shaming. I mean, that's really what it was. They make you wear a mask everywhere. So everybody sees you with a mask and go, I guess, they didn't. So it's going to be the same thing. If let's say I have a business and I say, in order to work for my business, you must get the COVID vaccine and you must give me proof. That's really what it is, Andrew. Don't that's really how they do it, Andrea. So as like I said, if you think about what you've had to do for clearance for clinical, I mean, I'm sure. Do you really wanted to do all of that? No, but your objective is to get in and pass and go. And I'm sure it's going to be something similar with COVID. But there's a lot of trust. There's a lot of trust that goes in, and you have the anti-vaxxers, and that happens as well. I don't know. I just don't want to hear of anybody else dying of COVID. We've lost too many. Do you think the research on long term, I think that's a question for, I don't know, Dr. Bill Gates. I'm sorry, Dr. Fauci, CDC. Miles, here's the thing. Remember, people, SARS is not new. This is SARS 2. That rhymed. Wiki, So SARS is not new. They've been doing research before. It may seem that this happened so fast, and I'm not privy to all of that. But if you recall that gentleman from China who was, oh goodness, I forgot his specialty. Was he an eye doctor? The specialist from China that was trying to prompt them about it, and they brushed him off and ended up dying. COVID, listen to me, COVID has been around before 2019. I've spoken to people, and based on what they have told me, they had COVID. COVID has been around. SARS 2. So remember, SARS 1 was the first one. This is SARS 2. So I would like to think that they were in the process of developing this vaccine. But the second part, long-term side effects, I don't know. It's back to that. Who is that one person? Who is that one person that is going to happen to? And I'm really at a loss for words. But let's talk a little bit about virus. And I'm going to share something that this an amazing instructor told me. I remember when I was doing my master's. Geez, long time ago. Shout out to LIJ because they paid for that degree. Oh yeah, I took advantage of all those stuff, and they paid for me to go to. Shout out to my alum at Delphi University, Phil Panthers. I really, once you're a nurse, I'm going to be honest with you. My best courses and my most were the non-nursing courses. I just really, I don't know. So I took this epidemiology course. I even took an accounting course. I took an amazing elective called the social structure of sports because I love sports. So well, it's been changed with all the whatever. I love sports, but so if you look at sports is a good way to view a society, and that's really what was the purpose of the sport. If I were to come to the UK, Miles, and I would want to do an analysis, I pretend I don't know. I could do an analysis of the UK based on sports. I mean, for instance, Wimbledon. I mean, how wide is that? I mean, I have been to Wimbledon. I jokingly laugh that I went to Wimbledon, so it's just Serena, Venus, and my family. But um, so the social structure of sports in the United States, men get paid more to do the same job. Doesn't that happen in society? Sports. Men are aggressive in society. My girl Serena slams her racket and the whole world comes to an end. Same disparity in culture. So this epidemiologist, she said, this is what she said, which is true. Think about that. Viruses come in all different, right? Some virus, you get them and it kills you right away. Other viruses hang out like a stealth bomber under radar, can't detect it. Other viruses wait until you're immunosuppressed and then it kills you. Look at HIV. Look how many people died of HIV, right? Look at there are people living with HIV. And don't say, oh, it's just the rich. There are plenty of rich people that died of HIV, right? So I don't think we know enough about SARS-2, COVID-19, but I'm looking at it similarly. I'm looking at it similarly. Miles, I don't know if you or Andrea, or know, a lot of change happened with how COVID was treated. And I heard that from people um, on my block where I live. It's our house, a medical house, the house that I share a fence with, a medical house. The next house, I think 4 houses, educators, nurse practitioner, veterinarian, nurse practitioner, another nurse practitioner, physician, right there. We have this conversation when the neighbors are chatting. And, one of my neighbors who works in a major medical center in New Jersey, we're talking about that, there are people that were coming in with a low pulse ox, low pulse ox. When they put the pulse oximeter on, the pulse ox is low, but they have mild symptoms. Now, you and I know you've learned, we talk about what's a good pulse ox, 94, 95 or above for someone without any respiratory compromise or respiratory chronic COPD. If the person's a COPD on a good day, if they're 92, we're happy. A lot of these patients came in earlier, and they had a lot of low pulse ox, respiratory. A lot of them were intubated early, and I think there's some change in the treatment again from learning that intubation. They'd started to delay intubation. Many patients didn't get off the vent. Another physician I heard who described what happened to these individuals. It's like your lungs becomes almost saturated like a sponge with water. It's so saturated like a sponge with water, and you're squeezing and the water can't come out, and just really sad. But here we are. And so Miles, I think the UK is starting. I'm not sure. I mean the UK have a lot of problems. Brexit, in addition. But I believe the UK, if not started, will start to give the vaccine. But here we are in the United States is still standing, and it will stand as long as we have an opportunity and freedom to speak. I think we should use our voice not just for ourselves, just to be able to advocate for another human being. And I'm grateful for this country. I love, yeah, I love my country. I tell people I'm Jamaican by birth, American by choice, and that's really how I put them. The freedom that I have here, I don't think I could have that in too many other places. So I think that it is. But Miles, I learned a lot about midwifery from my family and friends in the UK. I don't know anybody in the US who's ever been, whose birth delivered by midwife, but there are midwives here. Oh, Miles. Oh, yes. And I get sometimes I get abused for that. Well, not abused because I don't put up with stuff. I listen. I think you should be truly open and be honest about it. I mean, what country could you go and stand there and burn that country's flag? You can't do that. You get killed, you get your hand chopped. Yeah, I love my country. It's far from perfect. It's far from perfect. Listen, it's far from perfect. I could tell stories. I have my stories, but every day is not a bad day. And not every person mistreats me, and I don't mistreat people. So I really look at, when I meet a stranger, I say hello. I I give them an opportunity to prove to me that they're human. Some people rise to the occasion, and then that's just really what it is. But I think that's just there's more good in this world than bad. I think the bad will always say, "Hey, I'm here." The good, sometimes you have to look for it. You have to peel the layers away and look for it. So here's COVID. What good came out of this? I'm lost for words, but at some point we're going to have to look back and find some good that came out of it. In the scope of online learning, I did that before this. I did Zoom before COVID, but I am grateful that for those naysayers and those who had no value for online learning, COVID made them learn. COVID has also exposed some of the underlying health disparities, and I think that could be another video that I could do. Who got COVID more? People who had lower socioeconomic class, poor access to healthcare, not trusting the healthcare system, underlying health conditions. I mean, where have we heard that before? So but COVID still went for those usual victims, but COVID was not discriminatory in who it got. It killed a lot of quote unquote healthy people, or people didn't know that. I think we take new measures in how we conduct a pandemic. Absolutely, absolutely. Miles, I mean, I don't know. I mean, I travel a lot. I'm on a plane quite frequently. And I remember at the airport, we used to see Asian people, individuals with the mask on. Remember the bird flu? And I mean, it's almost every time at the airport now, I think how commonplace wearing a mask is. I hate it. I really hate it. I really, oh, Andrea, I'm really, I'm sorry about that. She says, online school has made me extremely depressed. Online, it's lonely. It is lonely. You have to be a bit more autonomous. It's different seeing somebody in person or even seeing your other classmates. It's you're I mean here you're doing it online. You're not you're physically in your home, so people in your home still expect you to be there. So it's like you can't be two places. Andrew, I hope you have some resources. I hope you're passing. Please, I hope so. I hope so. Um, so it's the only thing. Like I said, I hope COVID. It's really a stretch to find something positive. But I've always, uh, I don't know. 2020 has been a year when they announced that it was going to be the year of the nurse and the midwife. Who knew? Who really know? So, Miles, what part of the UK are you? I'm going to pretend like I know so much more than Bristol, um, Buckingham Palace, Sheffield, and that. Well, Andrea, so listen, so I think we're coming on. I really enjoy. Oh, let's see. It's definitely an eye opener. We're building more efficient transport. Got to look different. Yes, benefits, but it's hard to stay motivated. Yeah, Andrea, I mean, it's hard to stay motivated. Sussex, you're near London. There's Sussex. You're passing. Yeah. Listen, Andrea, it doesn't say RNA, RNB, RN barely pass. It says RN. Your goal is to finish. So I'm happy about that. I'm happy for that. Yeah, Miles, I've been to London. I did the whole touristy thing. Yeah, I did that. And I did go to Wimbledon. I'm a tennis lover, so I did go to Wimbledon. And the stop for Wimbledon is not Wimbledon on the tube, but it was much easier to navigate. Yeah, but I do have a lot of family there. Um, Excel, and perhaps I need to stop over by my name is Spencer. It's royalty. I need to go claim some Spencer something. I don't know. But Excel with flying. Yes, tell it, Andrea. Andrea, yes, Miles got you. You have from the UK. Shout out to you. So yeah. I wish you all well. I want you to stay well in whatever our conversation. I'm gonna still try to come on and do live. I'm glad I'm doing this from my webcam. So 'cause I just got to get my phone call. So I'm doing from the webcam. Spencer, yeah, Spencer's royalty. That's right. Spencer is royalty. My grandfather on my father's side is Spencer. So yeah, Prince William is my cousin somewhere. Winston Churchill is a Spencer. A lot of people don't know that. So, you know, next time, I'll come. I'm sorry, let me put on my crown. Yes. But Spencer, oh my God, my friends used to call me all the time when Diana was in the news. She goes, "Oh, Cheryl, your cousin." Again, Andrea, see you Andrea, you got a UK shouting you out over there, honey. Got the flag in the air. Go Trinidad, go Jamaica. Okay, that's great. Listen, this was great. I thank you so much for this nice little party of five or so. I love it. I really love it. I'm trying to do this YouTube thing, and I have some ideas from it, but I think it's nice to do it personally. I'm not so big yet that I can't do that. And again, this whole channel was a suggestion of a student. So I'm slowly trying to what's your name? I'm a new sub. Oh, so you just saw that. So my name is Cheryl Spencer. Or so I don't want to do the whole thing. Yeah, I'm Nick. Hey Nick, how'd you get the Miles Morales? Welcome, Nick. So yes, I'm Cheryl Spencer. I mean, sometimes they call me, I don't know, the whole Professor Spencer, Dr. Spencer. I got all them credentials, darling. But it's okay. I wanted to pick a name of a title that's not so catchy and not so, yeah, all that. Nick, the same way I talk right now is the same way I lecture. I talk the same way the students can relate to it. The webcam is acting up. The same way I talk. I don't sugarcoat it. When I lecture on hypertension, oh, Spider-Man, Miles Morales, the new Spider-Man. Oh, that's cute. Oh, let me get my web. See, I'm hip. Here's an example. Hypertension. Ladies and gentlemen, welcome to class today. Today we're going to talk about hypertension or high blood pressure. Before this class is over, I'm going to give you your homework. Your homework this evening at the end of your hypertension, high blood pressure lecture is to go home and take a very good look at your mother. I want you to look her up and look her down. These are the cards that you're dealt. And they just have such a laugh because I'm telling you, there's some risk factors that are genetic and there's some risk factors that are from socialization, so I'm just trying to do that. Yes, Andrea, I was told stay consistent. So like I said, it's just, because my emotions with, everything, with everything that went on this year, I'm really trying to get back to just doing very consistent videos, and it's still going to be current events related to health. I know enough people in the business. Hopefully, I'll try to get some of them on. I don't have to do all the talking. I'm not an expert in every field. If I want to do something on, say, a psych, maybe I'll do like a split screen, kind of like my girl Naomi Campbell or Patrick Starr. I'm so in love with him. Hypertension is on the final. Oh yeah. Oh, hypertension is on the final. So hypertension, remember, okay, so here's your tip on hypertension. Let me just give you a tip. You like that, Andrew? I'm going to give you a tip of the hypertension. Sometimes I probably give it too much because it's for an upper semester, but hypertension, I can name you, let's just for now, I'm going to give you 4 different groups of medications that lower hypertension. A lot of people don't know that, right? They just think, oh, it's a medication. So here, a beta blocker, such as metoprolol, carvedilol, all the laws, beta blockers, brain heart, beta blockers. A diuretic, there you go, a diuretic, such as furosemide. It's fluid shift. It can lower your blood pressure. ACE inhibitors, angiotensin converting enzyme, works on the kidneys. Angiotensin in its stable form, it's fine once it converts. So angiotensin, want to inhibit that. You have an ARB. Some of them convert anyway. An ARB such as Cozar. You have calcium channel blockers. So when a patient says to you, why are you giving me 3 different pills to lower my blood pressure? How best should the nurse proceed? Doesn't that sound like a nursing question? Well, you could say, you've beta block. Oh, there you go, Nick. Tons of them. You could say to the patient, most patients high blood pressure, they're started on a medication with very few side effects, but sometimes as it progresses, you may need another medication to help lower it a different way. That's it. Nick, I'm telling you, there are nurses out there who don't understand that. But that's kind of how I lecture. So, Andrea, listen to me. All the best on that final. Nick, I have no idea what those mean, and I don't study nursing. You're so funny. Trust me, Nick, you know enough. You know enough to be at this channel. You enough to shout out your girl, wave your flag, shout out to Trini. Understand that this world is a beautiful place with everybody having an opportunity. Fine arts, ooh, yes, that's awesome. That's awesome. That's good. That's good. All right, so listen. I'm gonna sign off, and Nick and Andrea, you're all. Thank you. Okay, I'll try to get some more stuff. So for those of you who've been here before, thank you. And remember, I sign off the same way. So remember, it's hard to remember 1 million side effects. Well, before I sign off, so Andrea, no. So you can't remember side effects. Here's what you must remember. You're giving them a medication to lower blood pressure. The main issue is that it lowers the blood pressure too low. That's it. That's your first thing. I'm giving you something to lower the blood pressure. I'm taking the blood pressure before to make sure it's not too high, because my biggest fear is that you drop it too low. So you need to teach your patient what to do when the blood pressure is low, and then all the other side effects. I do the same thing when I teach them on diabetes, right? I'm giving them an oral hypoglycemic to lower the glucose. Your fear is that it lowers it too fast. So you must teach them what to do for low glucose. All right, so look at it that way. All right, so let's see. Okay, nerd. Who is it? Have you anybody here ever solved one of these? Have you, Nick? Have you solved one? Have you, Andrea? Anybody else? It's all memory. Maybe next time I'll sit here and I'll solve one while I'm going through. I think I'll do that. The next time I may have to stop and look, and I'll do that. So, all right. So listen, thank you so much for coming. So let me do my sign off. Okay. So again, as always, I can teach you. It's memory, and there's YouTube. Maybe the next one I'll solve one. It's about really, you solve the bottom layer by layer. Tons of videos on YouTube, but I have it memorized with what I can do. All right. So this was a pleasure. So as always, if this is your first time to my channel, welcome. I hope you stay. Have a good day.